Hey guys, today we're going to be speaking about the USMLE Step 3, CCS mnemonic subject wise. And as you guys know, like I've given you guys in my previous video, which I'll link in the description, it's like a brief overview of all of the tests when you order for CCS case and help you score so many points on test day. This one is more subject specific. So if you get we have 10 systems, okay? If you get a patient from one of these systems, what test to order for that symptom to score points in that. Guys, you don't need to copy paste, take screenshots. I'm gonna keep all of this in my description to my link to website. It's completely free. You can get all the notes, completely free access. Okay, you're gonna have 10 systems, guys. We need to know cardio, endo, GI, hematology, oncology, musculoskeletal, renal, and neuropsychiatry, renal, psychiatry, reproductive, and pulmonary. So those are going to be 10 key symptoms systems over here. So the first system is be cardio. Cardio, guys, you just want to know about like pericarditis. It's going to be your rheumatic fever, and you want to know your autoantibodies. Pericarditis has so many causes, but one of the key ones are going to be like your antibodies, rheumatic fever, autoimmune diseases. And you also, when we give like NSAIDs for pericarditis, we want to make sure to give a PPI because we do know that NSAIDs essentially decrease the amount of prostaglandins, so you decrease the amount of blood flow going to your stomach. So you want to give these antacids like PPIs that kind of to decrease the amount of acid causing less damage to the stomach. Okay, the second system is endocrine. It's not too important in prolactin. Let's come into one of the major systems. That's GI. It's a huge system. All right. So GI is gonna be you're gonna have this mnemonic. It's not the best mnemonic, but it covers all the tests. Hos, not hos, Hos del na app. So HOS over here stands for H. pylori. O stands for ondansetron. H stands for hepatitis panel. S stands for stool. So stool studies. There's so many stool studies. You can do PCR. You can look at toxin. You can look at ovoparasites. You can do gram stain culture. So there's so many stool studies. The D stands for diet high in fiber. E stands for enteroretrograde cholangiopancreatography. L stands for lactose free. L stands for lipase enzymes. N stands for NPO. N stands for NGTU. A stands for weight aspirin. A stands for weight NSAIDs. A stands for anti-endomysitis antibodies, which are going to be anti-IgA antibodies, but there are also other antibodies, anti-TGT, anti-D-aminoglide peptide, or anti-IgG, D-aminoglide peptide. And then we can see antibiotics for any perforated ulcers, and then we can see PPIs as well. So that's a really nice mnemonic. Then we're going to have our hematology oncology. Again, you don't really necessarily need any mnemonics. You can, of course, look into bleeding times. You can look in coagulation panels, prothrombin, partial thromboplastin time, but that's case specific. So I haven't really made anything where. Let's go to musculoskeletal. Now, this is going to be four key tests. So you can remember this as AIAS. So IAS or whatever. So A stands for antibodies. I stands for imaging. So that can be ultrasound, X-rays of that specific joint. So it is the fingers, the knees, or the hands. You want to look at into that. And then we can also have the arthrocentesis. We can also have arthrocentesis. And S should be serum uric levels over here. Okay, so then we can have over here neuro. Neuro is going to be your CT scan, aspirin, and your seizures. And then we can see no CT intention headache. That'll be kind of not useful. And we can say like during driving, like, and we want to do like, of course, avoid driving while having seizures because that's super dangerous. And also I wrote aspirin here, which is already mentioned over there. And aspirin is really for strokes and all that stuff. You want to give aspirin to prevent coagulation, all that stuff. Next is going to be psychiatry. So psychiatry can be SPSSS. So safety plan, prevention, suicide, the precaution suicide, substance abuse, and social workers. We can also alcohol, salicylic, and substance abuse. And we can see over here advise patients of effective antipsychotics. Then we're gonna have over here so again, guys, over here your renal and reproductive system over here. You want to kind of avoid those because like I mean renal, like you're doing your creatinines, you're doing your BUN, which we do in our metabolic panel studies, and reproductive, like again, like you want to maybe look at hormone levels, maybe imaging techniques, but it's nothing mnemonic necessarily. Respiratory, it's a really big system over here again. So you want to look at, of course, sputum. So that's something you want to look at. Sputum gram stain culture. You want to look at peak expiratory flow rate, peak expiratory flow max. You want to look at hypertropium for like kind of like, of course, asthma or like COPD. Okay, and then it's going to be your We can see steroids from COPD exacerbation, and we can also have blood cultures over here. Okay, so we can see over here sputum gram stain, sputum culture. We can see expiratory flow rate. We can see flow max, hypertropium, steroids for COPD exacerbation, and we can see infectious disease blood cultures as well. That's perfect. Okay, perfect. That's gonna be seen over here. So now let's come over here and let's come over here and let's do a quick review. So we can see cardio is going to be anti-nuclear antibodies or in the rheumatoid factors, and you want to give PPIs for if you're giving NSAIDs. We have over here endocrine, just look at prolactin or any hormonal levels. GI is a monster. So you want to know this Haas, Del, Na, App. So Haas is me H. pylori, O is me ondansetron, H is going to be hepatitis pleural, S is me stool studies. Your Del D is going to be your diet. You want to keep a high fiber. E is going to be endoscopic retrograde cholangiopatography. L is going to be lactose free diet. L is going to be lipase for pancreatitis diseases. N is going to be NPO, NGT tube. A, avoid aspirin. A, avoid NSAIDs. Then A is going to be antibody screenings. The other A is going to be antibiotics. P is going to be PPIs. And then we can see musculoskeletal is going to be AIAS. So this can be antibodies, imaging techniques, serum uric acid, and your arthrocentesis. And over here is going to be your neuro problems over here. So you CT scan, give aspirin and stroke prophylaxis. The psychiatry is going to be your safety plan, precautions, suicide, substance abuse, social workers, alcohol, salicylate, substance abuse. Then we're going to have and also advise of any side effects. We can see respiratory sputum culture, sputum gram stain, hypertropium, peak respiratory flow rate, peak respiratory flow max, and steroids for COPD exacerbation. And we can do some blood cultures as well. Okay, guys, so hopefully you found this video useful subject wise, and please do share this mnemonic. Please do like this video. Please do subscribe. More videos coming soon. Thank you for watching. Hope to see you guys next time.